My name is Dr. David Alper. I'm a practicing podiatrist in a small town called Belmont, Massachusetts, just outside of Boston. And I'm here today to talk with one of my longstanding and favorite patients, Rosie, about diabetic foot care, about the journey she and I have taken over the years to keep her healthy, walking, and active, and how she and I have worked together to make that happen. So, Rosie, good afternoon, and thank you for joining me.
And good afternoon to you. Um, my journey began probably, we'll call it 15 years ago. And I woke up in the middle of the night one night and I couldn't walk. So I went to my PCP and she sent me over to Dr. Alper. He wrapped up my foot and did whatever he had to do. And I waited a week, put me in a boot, and I waited a week and I went back so he could fix it, make sure it was right. And I've always had a problem with my feet because I've always had very bad ingrown toenails. And I've always just dug them out because I don't like people touching my feet, plain and simple. I just don't. So after my foot healed, I turned to Dr. Alper and said, well, I'm here now. I guess we better take care of my feet. And I had already been diagnosed with type 2 diabetes, which didn't excite me. But, I'm a very bad eater. And I was very big at the time. And yet I've lost a lot of weight due to, with the help of surgery. But he took care of my feet. And I don't know what he actually called the surgery to take care of the ingrown nails, especially on my big toes, which has been tremendous. It's a great feeling when you don't have that pain. But there's no way that I would not go. I understand these are tough times. COVID isn't helping anybody, I don't think. But we really need to be aware of our own feet, our own well-being. And, every night, I shower at night and I check my feet. I check between my toes. I make sure I don't have anything, no slits, no cuts or anything. And the only one thing I will say that Dr. Helper made me do was wear shoes in the house because I do not like shoes. When I come in the house, it's the first thing I always did was take off my shoes. Well, I don't do that anymore. I at least wear slippers. But I will not wear socks because my feet get very, very hot since I've become diabetic. But I would not miss one of my appointments unless I was deathly sick. And I just feel more comfortable, even though I check, that he checks and he makes sure that there's nothing wrong with my feet. So I go every 5 weeks and I wouldn't stop. But I do understand why older people, and I put myself in that classification these days, are afraid to go out during this COVID thing. But I would recommend it highly, whether it's your foot doctor or any of your doctors, that your well-being is more important. Because I will say Dr. Alper's office is always clean. Both the girls at the front wear a mask. Dr. Alper wears a face shield, which makes it easier for me to understand him. Well, I have a problem with people with masks on. I just don't hear that well, I guess, anymore. But I would recommend going and not stopping. It's too important. I think I'm more afraid that I might lose a toe or something, and I don't want to do that. That's not anything in my schedule for the rest of my life. But I would highly recommend that people go out and they visit their doctors and do what needs to be done, no matter how scary it can be. And I do understand how scary it is.
Have you changed your activities at all because of COVID, Rosie?
I don't get out as much now, especially now that the weather's changing, but because I have really bad asthma, and in the summertime it's tough. So what I usually do, and I know this isn't always the most appropriate thing to do, but I always wear my mask, is I go into stores and I just walk the aisles. And I usually pick something up that I really don't need. However, it just is what it is. But at least I feel like I'm walking, and I do climb, even though the stairs are difficult for me. I try to climb the stairs at least 5 times a day in the house. So I am trying to keep going. Um, we'll see with the weather how it's coming. This weather's really nice because I can breathe easy in this weather. So it's easier to walk and do things.
Well, I know you're a great hydrator. You always come in with a bottle of water. It's
Yes.
never more than a couple feet aside from you. You talked about one of the things that you and I have talked about before, and that's self-examination. Do you
Yes.
mind saying exactly how you do that? How you check?
How I do that. Um, well, first of all, I'm not that steady on my feet, people. However, I'm able to get my foot. I have a walk-in shower. So and there's really no lip. It's a very small lip. So I'm able to I have a, what do you call those things? A shower bench. And I'm able to get my feet, well, one at a time, up on the shower bench. I put the towel down first. And that way I can see better, if there's any cracks or anything like that going on with my feet. If I have any black and blues. I mean, lately I just get black and blues and I don't know why, but nothing ever hurts. But that's the only way I know how to do it now. In the olden days, when I could maneuver better, I would just put my foot up on a bed, but I don't have that ability any longer. So I make do, with the chair, and I'm always by my handicap bars near my shower, so that in case I feel like I might topple, I grab the bars. So, and that's important. It's important to have your grab bars and all. It's not easy, people. I will agree. It's not. But when you're diabetic, you just can't fool around. You just can't. And I hope I never start that fooling around. So.
And I know that you've been very cautious about the COVID situation. You and I have talked about that quite a bit. It's important for you, and you and I have talked about this as well, that diabetes doesn't necessarily make you more susceptible to catch the COVID. It's the consequences of it.
Yes,
and this
absolutely.
is why we're emphasizing people to not just keep their podiatry appointments, of course, but all their medical appointments.
Right.
So that, if in fact, for some reason, someone does come down with the COVID virus, that we keep the consequences of it as minimal as possible.
Right. Absolutely. I agree. And I don't know, how did you decide on the protocols that you're using in your office?
Well, that's a really good question. And the protocols come based on the Department of Public Health here in Massachusetts, as well as the federal guidelines.
Yeah.
You are correct. My staff and I wear a mask. I wear a shield because I do like people to be able to see me and hear me better. Every room is wiped down with antiseptic wipes between patients. There are sneeze shields up at the waiting room. We don't, as I'm sure you saw, we don't really have a waiting room anymore.
Right.
People come in now, we take their temperature, and they're brought right back to exam rooms so that the exposure to other patients is at an absolute minimum.
Yes.
People have to wait in their cars sometimes if they come early. Now it's getting cold, so you can't sit on the front porch, unfortunately.
Yeah, right.
Every room has got antiseptic gels, which I use before and after ICU. The staff, and after you leave, the staff wipes everything down from the doorknobs to the pens to the armrests that you used. And again, I think that you're seeing this in every doctor's and dentist's office.
Yes.
We must do everything to keep people coming. One of the unfortunate things, and you and I talk about this a little bit, though we don't like to scare each other, is that there has been a huge uptick in amputations over this year as the COVID has. And it's based mostly on people missing their doctor's appointments.
Right.
So it's not that necessarily the diabetes has changed, but the follow-up has changed.
Right.
And it's gotten to a point now where there is a amputation due to diabetes every 20 minutes in this country.
Really?
It has gone up almost 50% in the last 10 years, according to the American Diabetes Association.
Wow.
And this year in particular, more so. So the emphasis of prevention, the kind of macabre phrase of keep your appointments, keep your feet.
Right, exactly.
Is really very true.
Yeah.
Is really very true. In order to make sure that while you're doing a good job, that I can get a little better view than you do.
Yeah,
And the other thing, and you've done this as well, is that if you do notice something in your daily exam, that you don't hesitate to call.
No, absolutely not. Yeah. I believe in preventative medicine. I always have. And I'm grateful that my family taught me that, especially my mother. And I was grateful for 38 years that we had her after her cancer diagnosis, all because of preventative medicine. And yeah, I don't understand people. I don't understand people not going, and I can't even imagine worrying about if I was going to lose a limb. I don't know. No, that's not good for me.
And certainly amputation is not the topic of every meeting that we have.
No. I understand that, but I was very surprised when we talked originally, when you asked me in the office about this, that when you told me that amputations are up, I was kind of shocked. I'm like, wow, people really don't go to the doctors. And, that made me think about myself and, the appointments that I do a lot of video medicine things because, you really can't get into the hospital unless you're having a test. And, I don't know. I'm very grateful. I'm very grateful that I met you. And
thank you, Ruth.
And even though I will say to you occasionally, don't touch my feet, not now. Yeah, I don't know why that is, but I've never liked my feet being touched, and I think that's why it was easier for me to dig out my own ingrown nails. But the last time I did it myself and I nicked something, I knew, oh God, I can't do this anymore. I've got to turn it over. And I did, because I try to do everything myself.
Well, but the truth is for several years, you've had virtually no complications at all. Or
I agree.
You wind up talking about everything else but.
Yeah. And I'm grateful for that. That's why it doesn't bother me every 5 weeks. To come and take the drive over. It's not that far, and
you like my staff. I know that. As well.
Now.
So,
yeah.
But the message is clear, and you've made it beautifully clear that while it is true, we're trying to avoid as much contact as we can because of the COVID. To be afraid to go to a doctor's office is really going to be a high price to pay in the long run. And
Absolutely.
Again, not just podiatrists, but dentists, ophthalmologists, PCPs, endocrinologists, anybody that's going to, and we are trained and able to create an environment that is really hostile to the virus. And so
right.
coming and going should be able to be a safe activity.
Right.
It's not as pleasant as it used to be.
Yeah.
We don't have magazines anymore because we don't want the
I get it. In the visits aren't as long as they used to be. And I get that all. I understand that, and that's okay. I would rather do that than, have a longer visit like we do. And somebody else is waiting and they're having a bad time of something. I don't want to be that person that stops somebody else from being taken care of. And it's been a difficult 10 months. Is that how long we've been in this thing now?
At least that, yeah.
Yeah, and it's been difficult. And yet I do everything I can to keep my appointments, and I will push to get my appointments when they're due. And if it has to be video, it's video. If I can go in, I will. But, and you follow protocol there too. You can't go into a building, you can't do this without calling, and everybody has to make sure. But you got to go. It really is important. It's imperative. If you want to, my thing is I want to live as long as I can. And whatever I have to do to make that happen, I will do all the preventative medicine I can.
And that's why I give you a gold star every time you come. You're an excellent patient with diabetes. You drank the Kool-Aid and know how to care for yourself.
Yeah.
And the result is going to be that you're going to keep your feet, you're going to keep moving, and our visits are going to be short and sweet as opposed to catastrophic. And
I know. And I
of-
appreciate that. I appreciate what you do.
So,
and when you say to me, when you say to me, if you got to get cream on your feet, I know, but you do it in a nice way. You don't, you don't, some doctors, aren't necessarily that good. I will say that, but I really, believe me, if I did not like you, I would not be there.
Well, but you see the benefit of it, and I think
that's absolutely important. Yes, absolutely. It's yeah.
All right, well, Rosie, thank you so much for taking
you're very welcome, and thank you for asking. I hope I didn't mess it up for you.
This is Dr. David Alper, practicing podiatrist in Boston, Massachusetts, talking with my patient Rosie about the necessity for keeping your appointments, keeping care for your feet during our COVID, and even outside of the COVID, to make sure that you're able to live a good, happy, healthy life with diabetes. Thank you again for your time.